This video is going to overview all of these special tests for the thoracic and the lumbar spine. So the first thing I'm going to do is demonstrate the Babinski test. So the word Babinski has the word baby in it, so that can kind of be a cue for you. This is something that they always do as soon as mothers give birth to make sure that there isn't any spinal cord trauma with their babies. So what you do is you take a blunt object and you scrape from the heel up into the great toe. If the patient's toes splay, that would be a positive sign for potential upper motor neuron lesion. Another similar test would be the Oppenheim. So I'm not actually going to dig the blunt object into the patient, but typically you would if you were concerned of this. Essentially you take the blunt object and you rub it against the shin as hard as you can. Again, if you see the toe splaying, that would potentially indicate an upper motor neuron lesion. Again, I won't do that to my patient because it's very uncomfortable. Next, we have the Valsalva maneuver. So I'm actually going to have you sit upright facing Kyle. So this test is basically it increases the intrathecal pressure within the thoracic and lumbar spine. So if somebody has a potential herniated disc, a positive sign may be radiating pain or paresthesia. So what I have the patient do is say make a cinnamon roll with your fist. Good. And I want you to put your mouth on the cinnamon roll. And I want you to blow as hard as you can into the cinnamon roll. Good. Another way that you can have them do this is to have them bear down or say pretend like you're going to the bathroom. That's also going to increase the intrathecal pressure and cause the disc to herniate even more slightly, either posterior or anterior. That can hinge the spinal nerve. Go ahead and lay back. All the way flat. The next test that we have for potential herniated disc is called Milgram's. So I'm going to have the patient bring his heels together. He's going to squeeze his belly button and gently raise his feet about 6 inches off the table. Right here is perfect. If this increases any of the pressure in his back, any radiating pain or paresthesia down the back of his legs, go ahead and relax. That would be a positive sign for a potential herniated disc. Next we have the well leg raise. So within the name it says well. So if he's having pain on his right leg, I'm going to raise the well leg or the good leg. So if he's having shooting pain down his right, I'm going to passively bring him up into hip flexion. If he has any increasing pain down the right leg, so on the contralateral leg that I am pushing on, then that would be also a positive sign for a potential herniated disc or some type of sciatica. Next we have Koenig's and Brzezinski's. So for Koenig's test, I'm going to ask the patient to actively flex their leg up to about 90 degrees of hip flexion, if they can get that far. Great. If he has any shooting pain, I'm going to ask him to bend his knee to about 20 degrees, and that should alleviate his symptoms. Another test that is very similar to this is called Brzezinski's. So I'm going to have Cole again actively raise his leg up. If he doesn't have any symptoms, what I'm going to do is passively cervically flex him. So I, as a clinician, am flexing him. Go ahead and relax. If he was doing the Koenig's test, so again, remember that's active leg flexion, a whip. Good. If he has pain with this, I would ask him to flex his knee to about 20 degrees, hold here. This should alleviate his symptoms. If I add the Brzezinski's or the passive cervical flexion, this may also induce his symptoms. So you can pair those two together. Both of those would potentially indicate some type of nerve root impingement, specifically in the lumbar spine. All right. Next we have the slump test. So I'm going to have you sit up and face Kyle. So this is a progression. First thing I'm going to have the patient do is slump his shoulders forward. Good. He's going to bring his chin towards his chest. Next thing he's going to do is extend his leg up. Good. So it's a knee extension. If he doesn't have any radiating symptoms down the back of his leg, this is causing some tension on the sciatic nerve, I'm going to go ahead and have him raise his foot up towards the sky, so he's dorsiflexing his foot. If he has any burning sensation or paresthesia, this would be a positive test for potentially sciatic nerve impingement. Next we have the quadrant test, so I'm going to have you stand up. You're going to face this way. First thing the patient's going to do is cross his arms over his chest. Great. He is going to go into lumbar extension, so slightly back towards me. Good. He's going to laterally flex, and then he's going to rotate back towards me. So we're further closing those facet joints. If he doesn't have any pain with that, I'm going to apply an overpressure, so an axial load through the thoracic and lumbar spine. If he has any radiating symptoms or general low back pain, this may indicate a couple of things. Go ahead and relax. This may indicate SI joint dysfunction, general low back pain. It could be indicative of a potential stress fracture in the pars interarticularis, otherwise known as a spondylolysis or a spondylolisthesis. Next we have the Lassie, so I'm going to have you lay all the way flat on your back. Lassie is testing for irritation of the dural sheath. So I'm going to bring the patient passively into hip flexion. If he has pain here, I'm going to take him off a couple degrees, and I'm going to passively dorsiflex his foot. Again, if he's reporting any pain or paresthesia, that may be indicative of a dural sheath injury. Next, we have the tension test. So the patient is going to start in 90 degrees of hip flexion, 90 degrees of knee flexion, so 90-90. I'm going to just passively extend his knee while also palpating the popliteal fossa for the sciatic nerve, so that's just behind the knee, right in here. This would be indicative of potential sciatic nerve pathology if this was tender. If he is in this position, I can go right into bowstring. So bowstring, actually I'll just start from the beginning for bowstring. For bowstring, I'm going to bring him up into hip flexion, and then I'm going to slightly flex the knee and then also apply pressure to the popliteal fossa. So again, this would be similar to the tension, would be indicating potential sciatic nerve pathology. The next test is the Hoover test. So this is assessing if a patient is a malingerer. So malingering is another way of saying somebody may be faking their injury or over-exaggerating some of their symptoms. So what you're going to do is grasp the distal ankle of your patient. You're going to passively flex them about, 10 degrees or so. You're going to ask the patient to raise one of their legs up towards the sky. So for example, I may say, Cole, can you raise your right leg up? Good. And then relax. I'm essentially looking to see if he is applying a downward force on the leg that isn't going up. If he isn't providing a downward force and is just saying, I can't do that motion, then that may be indicative that he may be not purposefully doing it on purpose. I have never done that test clinically, but I think it is something you need to know for your certification exam. A couple more left. So I want you to lay on your belly. So this is assessing for femoral nerve tension. Remember, the femoral nerve runs on the anterior aspect of the thigh. So I'm going to have the patient passively flex to 90 degrees in their knee. I'm going to scoop his hip directly up towards the sky, at the same time while also stabilizing the sacrum. So remember, anytime you stabilize the sacrum, you put the palm of the hand inferior and fingers are pointing superior. And then I'm just going to apply force directly up. He's going into hip extension. This would be positive if he had any radiating symptoms or pain on the anterior aspect of the thigh. The last test is the stork test, so I'm going to have you go ahead and stand up again. And I'm actually going to stand behind you. So again, I'm going to ask the patient to put his hands over his chest. He's going to stand on one leg, so either leg is fine, we'll do both. Good. And then I want you to slightly extend backwards. Good. So I'm behind him in case he's going to fall. If he doesn't have any pain going into extension, I might apply a little bit of a downward force. Again, noting if there was any back pain or increased paresthesia or radiating pain. And then go ahead and relax, and then we'll do the other side. Great, and then just extend back. Good. If there's no pain, then I'm going to go ahead and apply an axial load downwards.